The first one that I want to ask is from Tia from Fox 32. It's actually for the doctor. There are reports saying that this virus impacts African Americans more. Are we seeing that in the state of Illinois? If so, why is that?
Right. So we are still early in this disease, but we have, some information in terms of the people that it has been affected. We'll continue to follow it, but if that were to bear out, I think as we put on our health equity lens, we already know before COVID was ever established that the health outcomes for various communities are already different, and those were already things that the Illinois Department of Health and all of our local health departments have been very keyed in on how to narrow those disparities. So if you know that those disparities exist in terms of health outcomes, you can imagine that overlaying a new disease is only going to exacerbate whatever inequities already exist. So the departments of health at the local, state level will continue to try to address these disparities, but as I'm saying, it's early, we're still looking at our data, but if that were to bear out, we would not be entirely surprised because we know what the existing baseline is.
Doctor, while you're at the podium, I have a question for you myself. The tests that are either in the works or could be coming out here very soon that could tell if somebody had the virus, how big of a game changer would that be?
Yeah,
and when could we expect them?
Yes. So those tests are ramping up. They're in limited production now, but they're going to grow. So that is something that we're all looking forward to. We know how important, how hard the governor has been working to help us to get more testing. And so I think even through his personal connections, he's helping us to get that going faster. So absolutely, if we know people who have already been exposed, there's an assumption that there's an immunity that comes after being exposed. That's what this test would be looking for. So that would actually help us to figure out how many people are still susceptible in our community, because we're thinking that the people who have already experienced the disease, whether symptomatically or not, are now out of the denominator of people who are still susceptible. And so that tells us how many people are still left to be infected and help project where that would be going from then on.
May I just add to that? This is you said, is it a game changer? First of all, they have the ability to do this test today. It's not in mass form, so we can't do it as many of those as even we can the COVID-19 test today. But it will be. It will be readily available. And why is it so important? Because as the doctor said, if we know that a certain number of people are immune, and we know that population is increasing because more people are getting COVID-19 and vast majority are recovering from COVID-19, so they develop the antibodies. Well, those people, in theory, are free of the virus and can't get it again, and therefore, when you start to think about how you reopen everything, having herd immunity, we're a long way from that, but knowing that in some community, perhaps you've got a large number of people that already had it and recovered, would be a very important thing for beginning to put life back to some semblance of normalcy.
Do we have any sort of timeline on when they might be available to the masses?
It's getting there. I don't know. Nobody's told me, that, 4 weeks from now we'll be able to do this in mass form. But suffice to say, I think as one of the glimmers of hope here is that we'll be able to know if you've had it, because there are many people, this may sound strange to people, there are many people that have never been tested. They got it. They had some symptoms, but they weren't drastic symptoms, and they recovered. I don't know what the numbers of those are, but that is at least what many of the scientists say now. And so the result is, you may already have had it, but again, I don't believe that it is a very large percentage. It's just that we would like to know, you would like to know, indeed, if you already had it and therefore were immune from it. And so I think we should work on that. But right now, what is most important is the testing on the front end. If you haven't had it and yet, and we can test you and tell you if you have it now, that's very important for the kind of care that you would get now so that you can more easily recover.
And Governor, this one is from Laura from ABC 7. Can you please ask the governor about PPE supplies sent from the federal government? A White House Deputy Director of Media Affairs tells us Illinois has received more than 500,000 N95 masks, as well as other types of masks, face shields, other equipment, and 300 ventilators, as well as 1 million MREs for first responders. Is this equipment in use in Illinois, and where do we stand on supply?
Well, I can't go through every single one of those items of PPE, but let me give you an example of something you just read off: 500,000 N95 masks. Listen, we'll take everything we can get. So 500,000 is, I'm thankful for 500,000. The reality is that we've put in a request for 7 million. We need millions more than that, in fact. Because remember, our first responders, our healthcare workers, they're using them in the hospitals and sometimes reusing them for a couple of days even. But eventually they do need to discard them. And you need another one. And so we're going through PPE as a result of the need to replace these things. They're not permanent. And so 500,000 is not nearly what we asked the federal government for. It's not nearly what we need. Indeed, we have on order millions and millions of N95 masks, and we're going to continue to have to do that because the federal government fell down on the job.
And there were some reports, just to follow up on that, there were some reports in the in the New York Times today about some of the masks that have been sent out to different states is unusable. Mm-hmm. Is everything that we've gotten from here in Illinois from the federal government, has it been able to be used?
Well, we became aware of ventilators that were sent to California. You may have heard this. And there was a celebration by the White House and, of course, by people in California that there were hundreds of ventilators sent to California. By the way, they need thousands, and so do we. But they received hundreds. It turns out many of them didn't work. Ventilators. Can you imagine sending that to a hospital and having that, proposed for use on somebody who needs it at that moment and then finding out that it doesn't work? So we now are going through every single ventilator. We received, I believe, a total of 450 ventilators. We assumed, frankly, that they would be operational. Why would you send us non-operational ones? But now that we've heard that other states have received some that aren't operational, well, we're going through every single one of those ventilators. The 500,000 N95 masks, and I think that's about the right number. I would have said 450, but 500,000 sounds about right. We check those. We spot check them. You can't really check every mask, but we open the boxes and we typically will take some sample out of a box and just make sure that mask itself works, and that way we know at least those are good, and then we can move on.
Okay, this one is from Lexi from NBC5. Can you have the governor elaborate? Is wearing some sort of face covering a recommendation or a requirement? When should people wear them, in the grocery store or also out on a walk or run?
It's a great question. So there's not a definitive answer to this, and I said this yesterday. I believe, and if you've been in a grocery store lately at any time other than at 3 in the morning, you're running into a fair number of people. There's no reason to take any risks. And by wearing a mask when you go to the grocery store, for example, you're really protecting all the other people that are there as much as you're protecting yourself. In fact, more so. You're protecting other people from your droplets, and they're protecting you from their droplets by wearing a mask. So the question is it required? No, it is not currently required. It is a recommendation from me based upon what I have seen from the experts and scientists that have written about this. Now we've seen the CDC recommend this. So I believe it's a good idea when you go outside. If you're in an area where you're not going to run into crowds of people, it is perfectly fine to walk around and just breathe the air without having to wear a mask. But if you're going into an area, stopping at a gas station, at a pharmacy, at a grocery store, or heading to one, it's a good idea, in my opinion, to wear one.
Okay, I have 3 more from my colleagues here. This one is from Marissa, from your colleague, actually, BBM. In the wake of
then why are you here if you're asking questions? I'm just kidding.
In the wake of 2 Walmart employee deaths out of Evergreen Park and other confirmed positives from stores in Chicago, are there contingency plans in place to both, 1, further protect these employees, and 2, also prepare for a scenario where staffing at these stores may be an issue due to sick calls?
Well, we are encouraging certainly the essential workforce and the essential businesses that are open to all take care of themselves. The businesses themselves, they know that their workers are vital. Many of the businesses, in fact, have increased the pay to the people who are coming to work because they know that how vital these folks are. They want to give them an additional incentive. And I would suggest, as I have, that people wear masks in any circumstance in which they're going to be coming in contact with the public on a regular basis so that they don't get it, and again, that they're not giving it to anybody that they come in contact with.
Okay, this is from Ryan Burrow from WGN Radio, who is my colleague. We keep getting calls in the newsroom, complaints from people about conditions at senior living facilities and a lack of social distancing or protective gear at places of work like factories and postal facilities. Where do you recommend people call, or what should they do if they feel like orders aren't being followed and proper precautions aren't being taken?
I would make two recommendations. And one is there is a Department of Public Health either in your city or in your county. And they should certainly be notified if there are groups of people, whether it's in an essential workforce situation or in public. If there are groups of people gathering, not wearing masks, and there's a danger to the people that are there. And there is if there's a group of more than 10 people and they're not doing social distancing. So that's one thing that I would suggest doing. I think it's okay also to go to your employer, and if your employer is not listening, to go to another level of authority, and that might include your local elected officials or your local police department, to just say, look, it's unsafe, and here's what's going on. Again, as I've said, the police are not running around arresting people, but they are reminding people, and elected officials are doing this too, reminding people what the proper social distancing really is.
Thank you, Eric. I'm Mike Puccinelli from Channel 2, and I wanted to start by asking you about the Apex in Illinois. New York's been broadcasting when they think they're going to see their Apex pretty soon. When do you think we're going to see ours in Illinois? Yep.
So again, there are a variety of models to look at, and I'm not going to pinpoint one because they're all put together by experts at modeling and statistics, and so they can be a little off. But certainly I would say that most of the models that I've seen, and there are a number out there, say that we will peak somewhere between the middle and the end of April. And, as we move toward it, you've seen the numbers that we report every day. On one day you feel a little hopeful, on another day it feels like we're going backward. And so it's very hard to tell, what's actually happening unless you look at it over a time series. And unfortunately, over a time series, as you see, we're climbing the number of people who have it, the number of people who are passing away. And so, I don't want to predict on a certain day that we're going to hit a peak. But I will say that it's very important for us to track this. And the reason it's important to track it is, obviously, it helps us determine what to do with patients who are in certain conditions. Could we, for example, begin to transfer patients, should we, to McCormick Place? Should we what are we going to do when you run low on ICU beds? You could, for example, add a ventilator and another piece of machinery to an existing bed that and turn it into a kind of a semi-ICU bed if in some particular place, ICU beds became unavailable. And then, very importantly, every day, frankly, we are working all across the state to expand the number of available beds. Sometimes that means moving 2 beds into a room that used to have 1. Sometimes that means putting a tent onto the side of an existing hospital and adding, units there. And in many cases, it involves us looking to acquire every day. We are ventilators from everywhere that we can, and I feel like every ventilator at this point is a life saved. It's probably multiple lives saved, and so that's why we're working so hard at that.
On March 2nd on CBS, we had a Harvard epidemiologist on who said that he thought 40 to 70% of the world's population would ultimately come down with COVID-19. Do you have any determination as to what percentage of Illinoisans you expect that will ultimately get this?
So, I don't. But I'll tell you the best that I can. If we had a vaccine earlier, then the answer would be a lower number, right? A vaccine later, a higher number. This virus knows no bounds. There are no boundaries that we can set here that says this virus won't cross the border between states or between cities or counties or between neighbors. This virus just moves. to every human being that it comes in contact with. And so we certainly run the danger that the vast majority of Americans may end up getting this. And I guess the only hope that comes with that, the only hope, is that we're able to flatten the curve, meaning that people will get it over time, and our healthcare system will be able to care for the people who get it and who have some serious illness in the process of it. And I guess, again, if you look at the statistics, 80% of people who get it have, very uncomfortable symptoms, some range of, very uncomfortable to maybe slightly lighter than that, but recover, 80%. And then about 19%, and I'm sure that the doctor will correct me if I'm a little wrong, but I think I'm about right, about 19% have some range of something more serious that requires hospitalization for some period of days. And then a smaller percentage require an ICU bed, a ventilator, et cetera. 0.7 to 0.9%, it appears, who get it pass away. And again, if we have a treatment, this is very important. If you have to get a therapy or a treatment that gets approved, and there are a number that are being tested out in the world today, here in the United States and across the world, that some of which look more effective than others. If it gets approved, right, and that treatment is able to save lives, I mean, that's a game changer. And that would be before you ever see a vaccine. And it's not a game changer in terms of changing the number of people who will get it, but it's a game changer in terms of the number of people who will get sicker, end up in the hospital, end up in an ICU bed, or end up on a ventilator.
We'll do one more from the room, and then we got some online.
Are you frustrated that there are some states out there that still haven't gone with the stay-at-home orders?
I'm frustrated for the people who live in those states. I mean, I'm frustrated for us, too. If you look at some of our border states who just went to stay-at-home or haven't even gone to stay-at-home yet.
Iowa.
Then, it's obviously this has an effect on Illinois. And so I would, I wish, but let me be clear that while, we can talk about those individual states, this should have been the job of the federal government to give guidance, in fact, to set orders for the country, because we know how this virus travels. We know it. I don't understand why the federal government has abdicated its role in leadership of addressing this virus.
Okay, and then some questions from reporters online. The president expanded the use of the DPA earlier this week. Is that enough, and do you want to see it play more of a centralized role in parts of production and distribution of medical goods?
Let me start by saying that as someone who used to be in business before I was governor, I don't like the federal government or the state government or anybody interfering in the private market, generally speaking. But in a national emergency, for God's sakes, the Defense Production Act is exactly designed for these kinds of circumstances. We are at war. It is a different kind of a war than we've ever had before against a virus, but we are at war. And we have the ability to produce PPE in this country and distribute it so that we have enough of it in every state as we need it. And we had the ability to produce enough ventilators so that we could reach at peak everybody that would need a ventilator in this country. But again, the White House failed to use the Defense Production Act to do this, to help us across the country. The White House. I can't invoke the Defense Production Act. They've only invoked it for a couple of individual circumstances, right? And it took them forever. When did they do it with regard to 3M? And it's just the other day, right? And then just 3 days before that, it was General Motors on ventilators. Well, guess what? If you ask General Motors, when are the first ventilators coming out? May? Well, most states, if you look at all the models, most states are going to peak, many anyway, are going to peak in April. And they could have started this in February, and we would have been fine. But we're not, and it's very upsetting.
How many additional field hospitals do you expect to get up and running in the next 2 weeks? How many beds total will those additional field hospitals have?
So these are the additional facilities that we've created. They're not really hospitals exactly, but but they are meant for people who are either convalescing coming out of a hospital, or in some cases it'll be for people who don't have COVID-19 and have some other ailment, and they'll be again convalescing, coming out of a hospital, but still in need of medical care. Those facilities right now, it looks like if you look at the 3,000 beds that we expect to have at McCormick Place. And again, I want to remind people who live in other parts of the state that, because the outbreak is so significant in the city of Chicago, that having something that large at McCormick Place was very important. But we also have in outer areas of Cook County, which also have very severe cases, numbers of COVID-19 patients. There are hundreds. If I think about the 3 hospitals that looks like we're going to try to build out and are building out now, it ranges around 800 beds, I believe, in those other areas, 800 to 900 beds, and I'll correct that for you afterward if I've got it a little wrong. And then downstate in different areas, depending upon the outbreaks, depending upon the expected number of hospitalizations, it can range in any given area from 50 to 200 beds around in different places across the state, southern, central, and northwestern Illinois. So altogether, we're talking about 4,500 beds perhaps across the state. Maybe it's probably between 4,000 and 4,500 additional beds on top of hospital beds that already exist.
Illinois companies are threatening sick employees with their jobs if they don't immediately return to work, and these employees don't want to spread the virus but also can't afford to lose their job. What should these people do?
They should report their companies, because we won't stand for it. Companies that are demanding that sick people return to work, at this moment in our history, at this moment as we're fighting COVID-19, those companies should be reported.
And this will be our last question. The Adams County Health Department says 50 to 100 people were together at a party the day that your stay-at-home order went into effect. Some people at that party now have coronavirus. Why do you think people aren't taking this seriously?
Well, let me say that most people really are. The vast majority of people in Illinois are taking it seriously, and we should all be very proud of that. I think you see it, certainly if you live in Chicago or Springfield or Carbondale. You can see it. Just walk outside. It's Saturday. There are not very many people around. So thank you to the people of Illinois who are taking this seriously, and that really is almost all of you. Some people aren't. We saw that, on the lakefront in Chicago. We saw that in some parks in downstate areas of Illinois. And all I can say is that those people either are not paying attention to the news or they're stupid. That's all I can say. There's no reason why somebody should be ignoring this. You could be giving it to your own family, and you could get it yourself. And we're not asking much. We really are not. At this moment, we're asking you to stay at home to protect people for some number of weeks now, and you should listen, because you're putting everybody in danger.
Thank you, everyone.
Thank you.